Hello, everybody. Welcome to our webinar today. My name is Laird Christensen, and I direct the Masters of Science program in Resilience and Sustainable Communities here at Prescott College. Very excited to have this group of alumni with us today, and I won't take too much time in getting to them, but I did want to mention, as we think about community resilience, back when I first started designing this program in 2014, when I was thinking of resilience in the time of climate change, I was thinking primarily of things like severe weather events, rising sea levels, those sort of infrastructural changes we might need to make in the communities that we live in. Then 2015, we had public dissent appearing in places like Ferguson, Missouri and Baltimore as people were expressing their outrage at injustice in our systems. And I realized, okay, we need to build into this program that sort of resilience too, social justice resilience. And now the pandemic forces us to rethink once again what it means to create resilient communities. Now, even from the beginning, we had created courses in this program in community health. That is a course that just ran this last session with Jaya Davis. We also have a course in emergency management and communication, which is taught by Ron Steffens here with us today. But even those courses, now that we're understanding one other layer of vulnerability that we face, we're already revising those courses. When you create a program like this that intends to be responsive to the needs of the moment, it does require this constant sort of revision. That idea that the opposite of resilience is vulnerability is actually very instructive right now. The ways that we understand ourselves to be vulnerable suggest the ways that we need to grow, the kinds of skills that we need. And some of those ways in which we could become more resilient have to do with policy. Of course, we're seeing failures of policy right now. They have to do with technology, but they also have to do with social networks. And that's something I imagine we're going to talk a fair amount today. How do we create resilient communities through social networks? So as we do prepare to move on to our alumni now, I just want to say that if you think you might be interested or know somebody who might be interested in our online Masters of Science program in Resilient and Sustainable Communities, we have an information session next Thursday at the same time that we're meeting right now. So please feel free to pass that along to anybody who might be interested. As we prepare to move into our conversation today, just a few things to keep in mind. First, we have a shared Google Doc for people to add resources, and that should appear before you in the chat link on here. So if you've got resources that you found really useful, please add them to that list. That'll be something really useful for us to put together as a result. If you have questions or want to share your own experiences, we ask that you use the chat box. It's down at the bottom of your screen. You'll see that. If your questions are very specific to a person speaking at the time, we will ask one of our facilitators to let that person know when they're done talking that a question has been raised, and that person might respond to you through the chat. If, on the other hand, the question that you raise is more general and might lead us to have a useful conversation at the end of our presentations, then we'll wait and deal with that then. Also, a video of this event and a transcript of the chat will be sent out to you after this presentation today. So hopefully that'll take care of most of our needs. Most of the alumni that we have with us today are Prescott College alumni, but we also have a few alumni from Green Mountain College. The two colleges, as you may know, have shared a mission really for years and years, and were co-founding members of the Eco League Consortium. As you may have heard, however, last year in 2019, Green Mountain College closed its doors after 185 years. And at that time, Prescott College welcomed us in with really open arms. And so we brought over about 150 students, between undergraduates and graduate students, to Prescott College. We brought over a dozen faculty and staff members, 4 of our graduate programs. We're also starting to have some impact on some of the undergraduate programs, food systems, sustainable community development, that sort of thing. And perhaps most importantly right now, we also opened and created a space for Green Mountain College alumni to become a part of the larger Prescott alumni community. We have the Green Mountain Center for Sustainability at Prescott College, which is sort of a headquarters for that, but also open to all alums and current students to try to focus on what can we learn as we try to become more sustainable working together here. So this is actually the first time we've had Prescott alums and GMC alums together in one place. I know it won't be the last time, and I'm really looking forward to having a chance to gather together with these 2 communities at national or regional reunions, that sort of thing. But enough from me. I want to get on to the conversation that we have before us today. And actually, I thought it would be nice to start with Erin Lotz, herself an alum, who is also our Dean of On-Campus Enrollment here at Prescott College, to just let you know a little bit about the kinds of measures that we're taking here on the Prescott College campus to deal with the outbreak. So Erin, I'll pass it off to you.
Great, thanks, Laird. I'm Erin Lotz, Dean of On-Campus Programs, and part of the senior leadership team here at Prescott College. And so there is a team working on our response to COVID-19 and then subgroups for particular aspects of what we're doing. I would say we probably started in earnest, early in the first week of March. And it's so crazy to think about the decisions we were deliberating on then are in some ways no-brainers now. Should we send students to Kenya? Now we know it was really good that we didn't. So it's just really crazy how fast-paced this whole thing is. I think that we do risk management at Prescott College differently than a lot of other institutions. And I think part of that is because for our entire history, we've had a very prominent adventure education department and have been managing risks of all sorts for a long time. The person who is in the driver's seat of risk management for both field studies and the college as a whole is Christine Preziosi. And she wasn't able to be the person, she should be talking right now, not me, but she wasn't able to. So I just want to put a shout out to KP, which is what we call her, because she's done an amazing job. And I do believe that her skill set as an adventure educator, managing risks in challenging situations, has really informed what we have done in the last few weeks. So not only are we just reading what, everything that's on the CDC, not only are we following other universities and seeing what everyone else is doing, but we're looking at each risk individually and assessing whether we can handle that risk or not. KP's been conservative. She's been right on the money, I think, in terms of what things we've decided to do and what things we've decided not to do. I would say that our risk management in this situation has also been closely tied to our values as a college. And so, again, we value risk. We've made a decision about pulling Kenya off of the, we pulled them back from the airport only hours before they were going to head off from the airport to Kenya, but we allowed our students in Kino Bay, Mexico to stay. They had already arrived in Mexico. They were in a safe location at our field station, and so they actually remained there for an extra about week and a half until it was clear that we shouldn't have them in Mexico any longer or crossing the border to get back. We wanted to get them back on this side of the border. So we value risk, we assess it individually, and it needs to fit our values. Another place where I think it fits our values, some of the decisions we've made, other colleges around the country and other colleges right here in Prescott have closed their dorms. And we are deciding to keep our housing open. We know that we have students who come from places that are more dangerous than Prescott, or Prescott is their home. They don't have another, parent's house or another location to go to, and we do not want to displace those students. So we're keeping our housing open. Luckily, many people have chosen to go home, and so our students are more spread out at this point than they were a month ago. And another decision I think fits our values. We decided to assess what money students have given us carefully, and students who paid us course fees to go to Keno Bay are getting a proportion of that back because they're no longer in Keno Bay. We also decided, though, while our classes have gone online, we're not reducing our tuition to an online rate as wholesale, because we know that the loss of tuition dollars would affect our ability to employ our faculty and staff, and we really don't want anyone to lose their job over this. So that was another really careful decision that fit our values. So I know I don't want to take up a lot of time. I'm happy to answer questions about specific courses or about the campus. Right now, the campus is pretty empty. Some people are using their offices, but we're observing very strict social distancing protocols. We've closed the library and science labs, and our instructors are getting lots of attention in terms of kind of switching to online on a dime, and they're doing a great job. Maybe that's
Great.
enough for now, Laird.
Thank you so much, Erin. And if you do have specific questions about the operations of Prescott College, you're welcome to post those in the chat and we'll get those to Erin. As we prepare to move on to the alums who've gone out into various communities around the country and beyond and are doing this good kind of important kind of work, I'm reminded in the best academic fashion of something that Mr. Rogers once said. When I was a boy and I would see scary things in the news, he said, my mother would say to me, look for the helpers. You will always find people who are helping. And really that's what I feel is one of the great advantages of bringing these perspectives here today, is we have all these people who are doing such important work in their own community. And to me, that's already been inspiring. And I hope during this difficult time, you're able to find some inspiration too from hearing them. I thought we might start today with Jen Weaver, who is a alum of Prescott College, who is currently the mayor of Hillsboro, North Carolina, and so is having to deal with the coronavirus in terms of municipal governance. So Jen, maybe we can turn it over to you for a few minutes.
Hi, thanks so much, Laird, and hi, Erin. It's great to see you. Please give KP a big air hug the next time you walk past her. So hi, everyone. For a little context, the town of Hillsboro is in Orange County, North Carolina, which is in the same county as Chapel Hill, where UNC Chapel Hill is. They've got a big teaching hospital there. And then that's about 15 minutes south. 15 minutes to the east is Durham, North Carolina, where Duke University is and all its incumbent pieces. And then a little bit east of that is Raleigh. And the Research Triangle Park is also here. So Hillsboro is a small town of about 8,000 people, but we're very proximate to some of the biggest job centers in the state of North Carolina. And there's a lot of commuting back and forth. So it's really not an ideal situation for, a highly communicable disease. So we also started thinking about this, I guess it was about 5 weeks ago, when I was talking to some staff members and said, there's a chance we might not be able to do our State of the Community in person, which is, an annual event where the room is filled with people. So we might want to think about that. And then it wasn't long before it was clear that one thing was not going to be possible. And to shorten the story, we were one of the first communities in the state to declare a state of emergency. And along with some other communities, had been hoping that our governor, so about a week ago, there were credible rumors that our governor was going to issue a statewide stay-at-home order. And then days go by and it didn't happen. And then Monday came and there was another credible rumor he was going to do it, and it didn't happen. And so that was when in Orange County, the authority to do that lies in the county, not with the municipalities. So myself and the mayors of Chapel Hill and another town, Carborough, worked together with the county commission chair we said, we just got to do our own stay-at-home order, especially when we learned that Durham was going to do one. We have so much travel back and forth, like we had to try and really make it as a regional event since it wasn't going to be statewide. So that went into effect about an hour ago, but the governor has now this afternoon issued a statewide stay-at-home order, much to our relief. And so thinking about that from the municipal standpoint, as a mayor, people are looking to you for the kind of the general like physical safety of the community. And then there's also, a ton of local businesses and people whose livelihoods are really at risk right now. And folks have already lost a lot of jobs. And so, thinking about how you absolutely have to put public health first. But and knowing that if we take the measures that we need to take and are successful, then that will look like an overreaction, right? So if you do what you need to do, then it looks like you did too much. And that's been, I think we're now at a point in the community where people understand that, but early on when we started talking about it, people were kind of like, what are you doing? This seems like, a little much. So I feel good about moving when we did, but, we're already into community spread here in Orange County with 24 cases today. And, I'm sure that's only going to climb tomorrow. And then the way I ended up on this call was really fun. So I was talking with another Prescott College alum and ADP instructor, Janine Canty. She's a good friend, and she was talking about how she had been, speaking with her folks about expedition mentality and how they were about to go into Costco, to do a big shop. And she was like, okay, remember expedition mentality. And that really just resonated with me as a tool and framework that I could offer my community, because it's really, since my Prescott College career is kind of ingrained in my everyday and how our family operates, but I hadn't until then thought about how it is so applicable to this situation that we're in, where every time you leave the house, you're, increasing the risk. You're in an inherently risky situation. So how do we behave in a way that protects the whole group around us, that is also protective of ourselves? And so when I did do the state of community, I framed it around the expedition mindset. And before that, I posed the question in the Prescott College alumni group and got great responses from folks. What does this mean to you? And that was really helpful. And so I gave that talk, streamed it through Facebook to an empty room. But I have had lots of folks in the community reach out and say, like, that really made sense. Thank you. That was a good one. So I feel good about how that turned out. Sorry, I'm just looking. I had made a couple notes before I wrap up and turn it over. Oh, but I want to, when Laird was talking, I was, just feeling some pangs about, the repercussions of this are going to be profound. Like whatever town any of us live in, it's, the financial impact on our state and local government is really going to be intense, and we were just a couple weeks away from sending out an RFP for a consultant to help us through a climate action plan for our town. And like, there is just no way we can think about doing that right now, because it's going to have such an impact on our town budget. So that's something I think I'm sweating about a lot, and it's going to be real for every town, wherever you live. There's my cheery news to end. So I'll stop there.
Well, thank you so much, Jen. And we should actually post a link to your state of the state of the town, state of the community address, which I found really inspiring. So we'll find that and we'll get that posted for sure. Next, I thought we might hear from Lee Steward, also a Prescott alum, who is the executive director of CHUM, which stands for Churches United in Ministry, up in Duluth, Minnesota. And I hadn't really put together CHUM with the fact that you're up on a big lake up there, but that makes a certain amount of sense to me. It's really great to have Lee here because of the work that she's doing with hungry and homeless people in Duluth. And I think hearing about that kind of work is essential because too often we're thinking about our own relatively privileged ways of suffering through stay at home or whatever it may be. But Lee, why don't you tell us a little bit about the work that you've been doing in Duluth?
Okay, great. Hello, everyone, and thanks, Laird. And I think about the stay-at-home orders and what do you do with people who don't have a home? And so we had to make our governor made an exception for that, and I'll get to that in a minute. So we're exempt. The homeless people are exempt from stay-at-home because they have no place to go, and that's particularly painful. So I want to give you a little bit of background on CHUM, the context of Duluth, and what we're doing here. CHUM is Duluth and St. Louis County's primary safety net for people experiencing homelessness and hunger. We're a consortium of 45 interfaith congregations, including a temple, so we don't go by Churches United in Ministry anymore. We made that CHUM, and then that gets the joke about, are we the bait fish or are we your friend? And we're both. We were founded in 1973. The mission is people of faith working together to provide basic necessities, foster stable lives, and organize for a just and compassionate community. Budget's about $2.5 million. $500,000 of that is food donated by the community to our food shelf. We're really healthy financially, which I'm glad about in this time. We have really balanced revenues, and we're not even this week alone. We were given $90,000 extra just from foundations who knew us because of our reputation, knowing that we could put that to good use to tackle what we're doing with COVID. Geographically here, for people who don't know, we're at the head of the lake of Lake Superior on land which is the traditional home of the Ojibwe and Dakota people. St. Louis County is the largest county east of the Mississippi, but still about 20% smaller than Yavapai County, but about the same population. Prescott has, Duluth has about 86,000 people in our population, maybe twice what Prescott is right now. And we won Outdoor Magazine's top outdoor town in 2014, and it's a great place to live. We have hundreds and hundreds of miles of trails and all kinds, ski, bike, hiking throughout, so it's a great place to live. But there's another side to it, and the overall poverty rate here is about 22%, though among the African American and indigenous communities it's as high as 50 or 60%. We're a white town. So the majority of people, 90%, so the people who are poor here, majority white, but the disparities, following the trend in Minnesota, which has some of the largest racial disparities in the country, are really extreme. Over half of the people who come to CHUM are from communities of color. So as I said, we're the safety net. Our emergency shelter operates 24/7 throughout the year. 1,000 people come every year, but at any one time we have about 100 people. Usually 60 people sleeping in the dorms, and then 40 people who, for whatever reason, don't want to check in for a bed but want shelter for the night. They can stay in our drop-in center. We've got tables and chairs and art and different things people can be doing. But we had 100 people last night. We never turn people away. There are some communities that are closing their shelters. We won't do that. We just put down more sleeping pads. We can almost maintain safe social distance in the dorms by doing head to toe and the distance between our beds, but we can't do that in the drop-in center. 2/3 of our guests have some kind of disability, which makes it impossible for them to live independently. Most of that is severe and persistent mental illness, and about half have some kind of addiction. Not so much opioids here, but meth, spice, synthetics. So we're dealing with people who are homeless primarily because the systems of care for addiction, for mental health, and systems of housing for people with very low incomes have just failed so completely. So, and fewer than 25% of the people who come to CHUM are homeless for the first time. So we're old timers. So we're stretched at the best of time, and COVID just adds more to it, but I really appreciate the expedition mentality. You know, I've been using the same kind of phrase that it matters. You know, I tell my board, no, I've got a lot of experience in moving complicated parts through complicated situations. So we have 5 confirmed cases in St. Louis County. We do not yet have community transmission. So we've been spending most of the time on mitigation and preparation. Homeless shelters are considered very vulnerable and risky because of high density of people and the numbers of people who have underlying health conditions. So we're a vulnerable population in a crowded situation. So we're all across the state, we're adapting. But weeks ago, as soon, maybe I'm going to say March 6th, we started taking mitigating steps. We rented more portable hand washing stations for the shelter and the food shelf. We promoted cough etiquette. We intensified cleaning and sanitation. We began a daily COVID update. We trained our staff. We started working with our local public health authorities on a plan when we actually move to isolation and quarantine, which we know we're going to have to. We know it's not sufficient for personal protection, but we have bought out Minnesota surpluses, 2 months supply of bandanas, and everyone wears bandanas as a sense of agency. Most of them have chronic cough. It doesn't help. It's not perfect, but it's better, and it gives people a sense of control and agency and does limit whatever it is that they're coughing out. A kind of a fun thing is that our local craft distillery is keeping us well stocked in 70% isopropyl alcohol. All we need to do is send a note over there, run over and get 21 gallons. So it's pretty great. We appreciate that community support. We screen anyone who comes to shelter who looks ill or has fever. If they've got a temperature over 100, we'll send them over to the hospital for testing. We're considered a high priority population for testing, so there's no chance that people would be turned away from that. One good thing, we haven't had a single fever, and we've been screening for almost 2 weeks now. We've worked really hard over the last few years to make a good bridge between the healthcare and the homeless community. We have a committee that includes both of the hospitals and us, and it's supposed to we've hoped to improve the quality and coordination of care, particularly at transitions of care. So these relationships have been built over many years. We have protocols, we have releases, we have communication systems, particularly in the emergency and in the social work departments. So they know if someone comes over that CHUM. Both systems have a screen on their intake that tells people whether the person is experiencing homelessness or not, and that triggers an automatic consult with social workers and automatic call back to us. And so it's that work that's taken years is really going to pay off now as we get into the more severe parts of this pandemic. Like Jennifer said, the county is responsible for public health, and so we're working with that county now on what they call an emergency congregate care facility. I call it a hotel for isolation and quarantine. We're going to be able to deal with, we have 123 beds, 5 groups of people who are isolated waiting for test results, people who have been tested positive, people who've had significant contact with someone who's tested positive, someone who has been in the hospital with the disease but has been released to make a bed available for someone with a more critical part, but those people still need some support. And then some people who are particularly vulnerable, like our frail elderly. We have people 85 years old in homeless shelter right now. We want to get them out of the environment into a safe place. So we've been working on this bed. Everybody, it's going to be great. They have a bed bigger than I've ever seen in my life. They're going to have TV and Wi-Fi. We're going to give organized smoke breaks and outdoor walks. We'll give free tobacco. We need people to stay put. We need positive and negative incentives so we will have security. We're training all our staff. We're going to hire up. We're going to need 18 people to staff it at full form. We don't have those people, so we're going to hire them. And we'll try as many as possible to get people who've had experience of homelessness so they can relate better to what we're doing. That's in the shelter. We're also working with about 100 people who live outside. All winter, we've had a warming center at Gloria Dei Lutheran Church. During March, we averaged 60 people a night who came in there at one time or another, and about 35 people made it their permanent or their main place for sleeping. That center is scheduled to close March 31st. And so we'll encourage people to come to CHUM, but we need to have a plan and are helping people to transition to dispersed camping. I'm going to put out a call tomorrow for 35 sleeping bags, and by Monday they'll be at my door. Duluth really responds well to that, and probably tents also. We're under a stay-at-home order starting tonight at midnight. We have a wonderful governor. If you want to see a governor who's a teacher, give an order at Governor Waltz's webinar on why he's doing this. It was just brilliant pedagogy. So people experience homelessness. I said they're exempt from it. They're free to travel to soup kitchens, shelters, drop-in centers, appointments, wherever they need to go. Our employees are considered essential services, but I've asked people as much as possible to stay home to minimize direct contact when they're here. We're about 30% outside of the shelter working on site, and in the shelter, everybody has to be full on deck because we just have to be there. Yesterday, Minnesota legislator passed a $26 million bill for homeless service programs to help deal with COVID-19. We're in the process of seeking funding for staffing for that emergency care facility, protective gear, food for our soup kitchen partners, and supplies for 4 Catholic worker hospitality houses that we work with. And so we in county emergency services have worked on several different model scenarios of how this thing might unfold when it actually hits CHUM. Like, what are we going to do when we have patient 0 at CHUM? And then what exact, and we've mapped that thing out and work to a very, very level of great detail. And I'm really confident in the plan. I've had great support from the county and the city. But I was gently reminded of a pediatrician on our board today by something that a Prussian general named Helmuth von Moltke said. He said, "No battle plan survives contact with the enemy." Yeah. So we're ready. We're ready for the first salvo from that little spiky thing. And we know we'll have to change, but we've got a good team on the ground. We've got a county task force working with us. We've got support from the police department, tremendous support from the community. So I say we shall overcome. We're not afraid, but we're not going to do it hand in hand this time.
Well, thank you so much, Lee. That's wonderful to hear about the work that you're doing. And Duluth, I believe, is also the home of another of our Eco League partners, Northland College.
They're right? On the other side of the river, of the lake, rather. We're on the north side of the lake. They're on the south side. Mm-hmm. But the cantor at Temple Israel is a Prescott graduate and teaches at Northland. So we're all in here.
Well, thank you so much. We definitely wanted to have a perspective from the medical community with us, and we're very happy to have with us today Dr. Cho-Long Kim Richards, who is the medical director at Axion Care, and Liz directs inpatient drug and alcohol treatment centers across Maricopa County here in Arizona. So Liz, thank you so much for being with us today.
Sure. It's an honor to be here. As many of you might know, Maricopa County and Arizona, our confirmed cases are in fact climbing. Luckily, the vast majority of you who are in Arizona are in Yavapai County. Is that correct? Yeah. So you all only have 9 confirmed cases up there, which is fantastic. Unfortunately, in the state, in total, I think as of today, according to AZDHS, we have 665 confirmed cases and 399 of them are in Maricopa County. So at this juncture, it was really phenomenal to hear Lee's great work just now, because it kind of goes hand in hand with what we're doing at Axiom and across several different drug and alcohol treatment centers. What's interesting is we're more inundated than we've been because people are continuing to, be released from jail, and all of those actions are not stopping just because we're, and it was really heartfelt when we're like, well, you can't stay at home if you don't have a home to go to. And that couldn't be more true. And what's interesting about what we're doing now, we're currently providing shelter and treatment with people with comorbidities, not just addiction, but as you all might be aware, addiction accompanies a lot of like mental illnesses, right? It's just a comorbidity that happens. And because of the different types of exposure to the elements, what we find is that they have underlying conditions that are both, that are medical, that are absolutely immunocompromising. So you have the diabetes, you have the heart disease, you have, you might have Hep C, HIV, things of that nature that actually renders these patients even further vulnerable to this particular infection that we have going on. And yeah, as of now, we're just being really diligent about protecting not only our patients, but our staff members as well, because we're currently providing service to over 1,000 individuals in various parts of Maricopa County. And some of the centers are residential, so that it looks like a home, which, they're licensed for 24 beds. And so social distancing becomes a little bit of a challenge there when there's 24 bodies in I don't know, maybe there's a house that's large and there's, might be a 6-bedroom home, but it's still a home and that looks like one. And then there might be a casita outside in the back. And it's really nice, but the social distancing piece becomes a little bit more difficult. And surprisingly, what's been positive about it is how we've all managed to come together to be diligent and to just become more aware of what we're doing. Something as simple as hand washing and making sure that that's being done. Like, how do we do it? Is it just enough? Because, it was at one point for many people, it was enough as long as your hands were wet, and then soap kind of made it on your hands somehow. Like that, it was enough at that point. And so now we're a lot more aware of what we do and how we do it, and how big of an impact that makes on everyone else's health. And it also, I think it's kind of allowed each and every one of us to kind of say, oh, hey, how are you feeling? And we are currently doing temperature checks upon entering the facility. We've locked down, we don't do if we have immunocompromised individuals who are on our staff, like our therapists and whatnot, they do a lot of virtual, a lot of telemedicine with counseling and therapy and all of those stuff. A lot of our follow-ups, even with primary care, have become primarily done through, through telemedicine as well. So that's kind of pushed those, our capability and our agility with going online with a lot of healthcare. What else has happened? The one thing that we've been having trouble with the most, which ends up being a little bit more a story of empowerment for all of us in this community, was the inability or the difficulty of finding food. So if you have a supply limit, or like you can only buy 1 pack of toilet paper per person, so then it becomes problematic because we're like, well, we have 1,000 people that need toilet paper. And it's just like, wow. So now do we have to take a team of people to buy enough for everybody? Do we have to have like a shopping crew? Those things have been interesting. And masks, gloves, of course, the PPE has been an issue. And the food was, just piggybacking on the food, what we found to be a solution was to actually contact directly the farmers themselves, the organic farmers that are just as impacted in the state, because the restaurants have shut down. And so now they're like, well, the farmers are like, well, we don't have the ability to sell the volume that we were. And I'm like, perfect. What we can do is, if you can make boxes for us, we'll go ahead and purchase. And it was the cheapest way, the most cost-effective way to get organic, healthy foods to these immunocompromised individuals. We would try to get nuts, seeds, for sources of like vitamin C. So we'll go to a citrus farm to get oranges so that they get natural sources of vitamin C. We'll go with, nuts and seeds, so Brazil nuts, so that they can have higher doses of selenium, things of that nature, like natural and food sources of the vitamins that they need to make sure that their immune systems are boosted. So it's been a really great experience for all of us. Yeah. I think that's it for me. Unless you have specific questions, and I'm happy to answer any of them.
Great. And if so, we'll try to direct those to you through the chat. But thank you so much. It's good to hear about
Sure.
what you're doing. Next, I wanted to hear from Ray Coder, who is a Green Mountain grad who's now the Director of Learning and People Strategy at the Broad Institute of MIT and Harvard University. And the exciting thing, the relevant thing about the work that Ray is doing right now is the sort of repurposing of existing technology and resources and human power from the Human Genome Project to actually diagnosing COVID-19. So Ray, we'd love to hear about the work that you're doing.
Sure. Thanks so much, Laird, and thanks for everybody for being on this call tonight and for the previous speakers. It's super interesting just to see the range of ways that people are sort of moving into this space and being adaptive and trying to solve these challenges at the local and sort of national level. So as Laird said, I work for the Broad Institute of MIT and Harvard. Just a quick background, the Broad has been around for about 16 years. It was founded in 2004, largely around this idea of being sort of Switzerland for science in the Boston biomedical community. So the idea was, being a place where people from industry, from various universities, from government can come and work unimpeded by the traditional barriers of a laboratory, of an institution. The Broad itself came out of the sequencing of the Human Genome Project, and a lot of our capabilities largely fall in the space of sort of genomics, so advanced genetics, and computational power and engineering. So for the last 16 years, what we've essentially been doing is using our expertise in these areas to identify, elucidate sort of targets for human disease treatment and bring those sort of targets to market. We are a scientific nonprofit, but we're a $500 million a year nonprofit composed of about 5,000 people right now. And Brodies, as we call them, are everything from Harvard and MIT faculty, Harvard Hospital faculty, academic trainees, so graduate students, postdoctoral fellows, undergraduate students, and then we have close to about 2,000 professional staff right now, which are professional bench scientists, project managers, junior scientists, software engineers, and it goes on and on and on. And so our sort of, just to think about the range of topics we focus on is everything from chemical biology and therapeutics and drug discovery to traditional areas like infectious disease, tuberculosis, cancer, psychiatric disease, diabetes, and largely more recently data science and data pipelines. So we are at our sort of core deeply collaborative and all about tackling big, human disease challenges by sort of leveraging the power of science, but also by the power of bringing people together to do sort of mission-driven work. And my job is sort of as head of learning and people strategy is to think about how do we bring people into projects? How do we get them the skills, the connections, to be able to effectively engage and drive the work ahead. So we're very team-based. So everything that we do is about aggregating the right people at the right moment with the right tools, skills, and sort of permissions or lack thereof as a way of tackling sort of complex biomedical challenges. So I'm very lucky to have a job that changes every day and largely involves being both sort of strategic, but also then getting people to figure and working with people to figure out ways to remove barriers and add different catalysts that drive innovation in this space. One of the things that we have historically focused on are infectious disease outbreaks. So we were sort of on the ground with Ebola. We had lab sequencing data in real time coming from hotspots around the globe. We've actually lost a number of people through that process, and we were able to show the sort of origins and the spread of the disease and figure out ways that can inform public health during that crisis. Subsequently, labs have focused on Lassa fever and in tuberculosis, and Zika was more recently a great opportunity to both hone diagnostic capabilities, but also sort of communicative pathways between sort of bench scientists, clinicians, and policymakers and healthcare professionals across the country. So COVID. So what we've essentially done very rapidly in the last 2 weeks, so again, so some said sort of starting in that first week in March, is all non-essential staff went remote. All non-critical labs sort of went sort of some remote and have phased out. And the vast majority of our research that was not focused on infectious disease and COVID has shut down or gone sort of into data analysis, while we've then ramped up a wide range of work in this space, both understanding sort of what's happening with the disease, understanding potential therapeutics, using gene editing and other genomic sort of tools to potentially target therapeutic therapies for this challenge. In addition, our genomics platform, probably the #1 genomics sequencing facility on the planet, which predominantly over the last couple of years has focused both to do biomedical investigation for our people, for sort of collaborators, also for clinicians around the country, doing sort of advanced genomics. So what this would essentially would look like is, physicians would send in samples of tumors and samples of other sort of human biologics, and they would be able to sequence them and get the data back so people understand what's happening. And this also in partnership with companies as well. Over the last 2 weeks, essentially what we've done is we've shut that down and transitioned that fully to diagnosing COVID. So we've completely revamped the CDC process, which was very sort of manual, and automated it using all of our robots, and figured out ways of developing new protocols that could do this rapidly at scale. And as of today, I believe we're able to now do 2,000 tests per day, and that capacity will just increase. So one of the challenges of that was, one, how do we take something, our CLIA lab, our sort of clinical lab that's developed for not doing viral RNA, and figure out how to reconfigure it as a way to be able to do it for viral diagnosis, in this case, COVID-19. We staff it. How do we get people to work? We create what's in there, so if someone does get sick, whether outside or whatever, they're not infecting the rest of the group. And how to purpose a wide range of our other population to figure out who has the basic skills. How do we train them up and now plug them in to be able to play a supporting structure as we scale our diagnostic capability? So it's a really interesting and exciting time, and it kind of is in some ways been interesting to watch and to play a role in, largely because it's been about building internal collaborations between our facilities teams, between government and state agencies, but a wide range of scientific actors, all trying to figure out how do you take something, adapt it in real time to do something that it necessarily wasn't designed to do, and to do it in a way with a wide range of partners. So we're now the key partner for the state of Massachusetts, the Commonwealth, in the wide range of hospitals here in the Boston biomedical community, doing sort of real-time diagnostics for COVID-19.
Right. Well, thank you so much, Ray. It's it really surprised me to think about the ability to shift so easily from one kind of research to another, essentially needed research at this point. And I think there are probably untold numbers of organizations and agencies who've made similar shifts that we don't really hear about, that are so important to meeting the challenges ahead of us right now. So I really appreciate hearing about that. Next, we have Greg Hayes from Boulder, Colorado, another Prescott College graduate. And Greg, it's my understanding, has just recently been starting a new organization called Friends for Life, which is focused on delivering supplies to people during the stay-at-home order. And Greg, it sounds like you're doing amazing work. I'd love to hear a little bit about your story.
Yeah, definitely. Thank you for having me on, Laird. I'm absolutely humbled, especially after hearing the caliber of people that came before me. So I'll tell you a story. I was in Tucson, Arizona, down in the Sonoran Desert, and the woman that takes care of my dad and my stepmother's horses called me and said, "I think I have COVID-19. And so I'm self-sequestering myself, but I can't get tested." She's from South Africa and has no family here, and is married to a woman, Lois, who's in her 70s and very frail. And so Pam was essentially freaking out. And the next day, she called me and said, "Greg, please come back home. Please come back home." And I think it was two different things. It was, she felt like she needed support, but she also was worried about my father and my stepmother because they're in their 80s. And so driving up from Tucson, I said, I'll be there as soon as possible. And my goal was to be here in 48 hours. It actually took me 3 days to get up here. And so I had a lot of time to think. And I thought about my dad and his respiratory issues. He's 84. And I thought about my stepmom, who's 86, and my mother, who's 82, and my stepfather, who's 80. My mom and my stepdad have been self-isolating for 5 weeks now because they were in Morocco when the COVID-19 really hit. And so they knew that they might have been exposed on the airplane. And so as I was coming back, I was thinking, my goodness, you know, I need to get there fast so that I can help with groceries and medicine and making sure that my parents get help. And then I started thinking about all their friends, because they have, you know, hundreds of friends in their 80s or 70s in the Boulder area in Colorado. And this idea struck me to start an organization that would be, oh, the other piece was, then I was seeing all these young people that had no job anymore because they were working in restaurants or a bar. And I would meet them in the parks, you know, playing Frisbee. And I'd say, hey man, how's it going? And they'd say, oh, this sucks. I've only got $200 left and I don't have a job anymore. And I don't have health insurance anymore. And so I was thinking about the young people and who had lost their jobs in the restaurants and the retail and the bars. And I was thinking about the elderly, like my father and my other parents and their friends. And it struck me that I had run a courier business in Burlington, Vermont for a number of years before I went to Prescott College. And I thought it was pretty fun. You know, I got to meet a lot of people. And I thought, well, heck, I'll just start up a little group of myself and maybe a couple friends, and we'll start delivering food and medicine and whatever the elderly need and the young people need in the Boulder, Broomfield area. And I thought, if we could make it a nonprofit and run it solely off of donations, then the Boulder community has enough wealthy people that hopefully we could bring in enough money to support the young people who have no money now. And so I got to Boulder, and on day one, I started, I asked both of my dad and my stepmother and my father and my mom and my stepfather to please call or send out an email to all of their friends as far as using a friendship tree type idea, because I know a lot of them don't use social media. And so they started calling around, and boy, I tell you, the feedback was phenomenal. And so we called it Friends for Life. And we have a motto, which is be well, be safe. And so we try to educate the elderly about how to handle COVID with best practices through the CDC and the World Health Organization. We make sure that they have good wipes and gloves if they need them. If we can get masks, which we can't right now, we haven't been able to get masks for days. We're only 6 days into this, by the way, Laird. And so we've drummed up a logo. We have a name. It's now, we ran into copyright violation problems, so it's now Friends for Life Couriers, because there turned out there was another organization called Friends for Life LLC. And so we rebranded. We're now recruiting young, healthy, energetic, kind, compassionate young people who aren't working, who are out of jobs, to be trained as couriers, and we're ramping up. And what's been amazing about it, from my perspective, is the feedback from the city of Boulder and the county of Boulder and the community. And like Lee Steward from Chum was saying, the homeless, one of the issues that I didn't realize was this idea of the homeless they don't have a home. And a lot of them don't know what's going on because they don't have a phone, They may not have, they can't go into the libraries now. And so we have had a huge response from the homeless. So they come up to us and ask us for help, and we ask them what they need, and then we just give them gloves, wipes, food, water. If they need medicine, we try to get that for them. If they have prescriptions, and for the elderly, we do the same. And now we're getting great feedback from the young people in their 20s and 30s that have no job. And so it's ramping up. We went into, for context, we went into a stay-at-home order in the city of Boulder, I believe 4 days ago. And then 2 days ago, Jared Polis, the governor of Colorado, put the whole state in a stay-at-home order. And so restaurants are closed. There's still delivery. Bars are closed. Libraries are closed. And so the homeless are telling me they're used to going into the libraries to get information, and they have no idea what's going on, and a lot of them are very confused. So we're adapting, we're growing, we're hoping to keep our wheels rolling. Right now, the city of Boulder and the county of Boulder are asking us to carry letters with us, with the couriers, so that if they're pulled over by the police because of the stay-at-home order, which I don't think the police are going to pull us over, or if somebody is asking us questions about our organization and they're curious about if it's legitimate, they can contact me at the central headquarters hotline that we've set up, and I can share with them that we've got the permission from the city of Boulder and Boulder County. Now, what's interesting is that the county of Boulder now is calling the 400 people on the Colorado volunteer list that they have to try to drum up more couriers for us and more help. And they want us to ramp up as quickly as possible and try to seed other cities with and other locations with the same type of model, where you train couriers to be very safe and we do drop and dash deliveries. We don't ring doorbells. We don't knock on doors. We don't chit chat with our customers. We just drop and dash the groceries or the medicine, and then we contact them on the phone so that they know that it's on their front porch or on their front door at the apartment. We always use gloves. When we can't keep people away from us, we always use masks, and we always use eye protection. And someone, was it Lee, that was talking about taking temperatures? We're trying to figure that out right now. We're taking temperatures of our couriers and myself on a daily basis in the morning and in the afternoon when we get done, to monitor our health, because like I tell the couriers, it's our job to take care of each other. It's our job to take care of ourselves, to be healthy, to get lots of sleep, to eat good food. And if you're not feeling well, to be honest, so that we can keep you at home and keep you out of the field. But right now, I'm just absolutely flabbergasted and impressed by all the love that we've gotten from the community, the support from the government here, and I'm proud of the work we're doing. And so I hope it continues, and I hope we can somehow spread the idea to other communities as well, because I think it's a good model. It works solely off of donations. Thanks, Laird, for having me on.
You bet, Greg. It's so good to hear about what you're doing. And it occurs to me that as you're looking to possibly seed this idea in other communities, if it would be possible for you to enter into the chat line a web address or an email address that people could contact you if they're interested in replicating something like that in their own communities, that would be a great use, I think, of this webinar.
Yeah, somebody is asking me online. It's funny, Laird, on this phone, I'm using my phone and I can't figure out how to do that. On my computer, I'd be able to do it, but I'm in a location where I can't fire it up, so I'm using my phone. Somebody asked, well, maybe you can share my email with everybody in the group, and that would be fine with me.
Okay.
And we have set up a hotline for our Friends for Life courier service that is a Google Voice that's not my personal phone. I didn't want to be using my personal phone, but the email that you've got is my personal email. You can send that out to this group. I would
Okay.
just ask that they don't like send it out to other people necessarily, but rather contact me first. But I'm really happy to share what we're doing here. I've been so busy, and the thing I wanted to answer was, where do we get our stuff? And we've been having a hard time with certain things like flour and yeast for making bread. People are requesting yeast and flour. We're having a hard time finding that. And so we've started a sourdough starter here at the headquarters, and we're working that up so that we can share it out and teach people how to make sourdough bread like in the old days.
Mm-hmm.
We're trying to get into the line at the grocery stores before they open. A lot of the grocery stores down here are allowing elderly in for the first hour, which makes me so sad. It makes me so sad to see these 80-something and 90-something people out in the community shopping for themselves with the COVID-19. Because what I understand now, and Ray will correct me if I'm wrong, and I hope he does, I've been told that the mortality rate for my dad's age group, which is in the 80s, is 14.8% right now. I don't know whether that's true, but that's what I've been told. That's a scary number. So when I'm out waiting in line, because there's always lines at the grocery stores, we try to stock up on what people will need, essential items. We're not delivering beer and cars. We're delivering essential items like water, good food, medicine, medical supplies, and now we're going to be delivering educational supplies for children who are sequestered at home too, when their parents ask. A lot of the school districts are doing a fantastic job with that already, but the homeschoolers sometimes may need some support. So we're going to deliver those too as well for donations. So we rip around the grocery stores. We are talking to farmers. Who was it that was talking about farmers? And that was Dr. Chu, I think, Dr. Chu Kim Richards, who was talking about connecting with farmers in Arizona. We've been connecting with farmers here too, because there were days here where we couldn't find chicken or ground beef, and people were asking for that. And so we went to the farmers. What else can I add? I'm not sure. We're just getting real busy.
Yeah, well, it's good work, and it's inspiring that you saw a need and you responded and started it up on your own. So thank you so much for that.
There's something about temperature there that I didn't get, but we're experimenting with temperature. We were trying to use an infrared temperature gun, but I don't trust it now. It seems to be giving low temperatures, and I've been told by the company that it can't be trusted medically. I don't know why. And they say that it's got a 2% error possibility, which seems like a lot when you're testing human temperatures. So we're now trying to round up oral thermometers, and we can't find them. So we've got friendship groups in the elderly community asking each other if they can donate oral thermometers to us, at least temporarily. And we'll sanitize them and then give each one of our couriers one, and we'll do it together so that we know each other's temperatures. The other thing I wanted to mention was masks. We can't find the N95 masks at all. And I have 4 now, and I have 5 other surgical masks. And then we have found, this is cool, we found a group in Broomfield, Colorado, who specializes in making wrestling singlets for competition out of antimicrobial fabric. They've retooled over the last couple of weeks to now make masks. And so they're making masks out of the wrestling material that's supposedly antimicrobial, which is a stopgap measure. And then they're getting in the N95 material to start making masks custom out of the N95 material in, I think now, 8 days. And then we have some people in Vermont making custom masks for us also out of several layers of cloth. So we're sort of doing the bandana thing like somebody else was talking about. Okay,
Right.
and by the way, the expedition mindset, I believe in that. Every time we go out, it's expedition mindset. And that's one of the things I worry about. I've done a lot of rock climbing and a lot of alpine mountaineering, and been on belay with people a lot, where you have to trust your partners. And I feel that's the way it is here with Friends for Life, is that we have to trust each other to step up if they're not feeling well, and to take care of each other just like you would in rock climbing and being on belay. And so I do worry about our couriers becoming vectors for the COVID-19. And so we're really trying to do our very best to make sure that they're tuned up in the most up-to-date information about COVID-19 and how to control it. Because I don't want any of our couriers to get sick because they're being a courier.
Right.
So yeah, that's one thing I worry about.
Yeah, and rightly so. Well, thank you so much, Greg. I think that's been an inspiration to all of us. And I do want to move on. We have a few more folks to get.
Thank you. Thank you very much.
Oh, it's a pleasure. So next we're going to hear from Suzanne Olson, also a Prescott College grad, a writer who manages communications and public policy for a small electric co-op up in the Salish Sea in Washington on Orcas Island, and it's a Orcas Power and Light Cooperative. Suzanne is also hosting Quarantined Together on Orcas Island and is the lay leader of the Orcas Island Unitarian Universalist Fellowship. Hi, Suzanne. Welcome. Are you still there? Looks like you're muted. There would be a little microphone in your lower left-hand corner.
Thank you.
Yep.
Well, thank you. It's great to see everybody, and it's also kind of fun to see some corners of the campus in the various offices that are tuned in and remember that wonderful campus. I graduated in 1992 after a very long career. I started in '82 and also worked in the president's office and the development offices in the interim. So very close ties to the college. And I'll talk a little bit about, well, first of all, let me set the stage for what our status is here on Orcas Island. We have the Orcas Island itself, we have about 4,500 people. It's a very small island off the northwest corner of Washington State, accessed only by ferry. So we have transportation and supply issues, very limited health care, and dependent on tourism and on a highly elderly population. I think the median age is 54, but the average age is much higher. I'm the public relations director for this electric cooperative, and we serve 20 islands here in the Salish Sea. And we responded really quickly because we're in a season where we are gathering with members for elections and member meetings and everything. So probably a month ago, we canceled all our public meetings and have progressively taken measures, including closing our offices and changing assignments for staff to keep social distances, which is a challenge with linemen in the field. So far, we haven't had any outages since the social distancing started where, the teams really have to work together. But our main priority is keeping staff well so they can keep the power on. We run power and broadband services to the 20 islands in the county, and we're very remote and isolated. So those are super essential services. You can't just hop over to your friend's house in the next county here. So keeping the power on is our biggest commitment, and broadband services, especially now. I think we'd have a total revolution if Netflix didn't work, although maybe that'd be a good thing. The other priority is then providing relief to our members, because we are a tourism-centric economy. It's hurting a lot. Lots of people without jobs. Most of our businesses closed. We only have a handful of restaurants on Orcas Island in particular, and there's a few now that are trying really hard to do takeout. But our grocery, we have 3 grocery stores, one big one co-op, and one kind of small boutique one down by the ferry landing, and we have a pretty good supply here, but it's being challenged not only by fear, it's also being challenged by the hordes of people who are still coming to the island because it's spring break in Oregon, and people from the cities who think maybe coming to Orcas Island would be brilliant to protect themselves and their families from COVID-19. So we are this community of kindness and welcoming and really laid back, and we're really challenged right now to figure out how to meet each other's needs, and then which we're really good at as islanders, and how to create boundaries so that we can stay safe. The status on Orcas or in San Juan County is that we have three cases just in the last few days. We have a stay-home order just the last few days. In Washington State, though, as you've probably heard, it's one of the hot spots. I think there's about 3,700 cases and 175 people have died already. We have this, moat. We have this little bit of isolation. It's quite a drive and a ferry ride to get from the Seattle area to Orcas or to the island. So there is a bit of separation, but a lot of back and forth traffic. And we've now created a travel ban that has stopped to some degree that traffic. I'm also the lay leader for the Unitarian Universalist Fellowship, and we have a very small group on Orcas, but it's lovely, and it's been a real challenge because most of those 20 folks are super elderly, and it takes a lot of individual care to try and understand and meet needs now that we're all remote. But it was actually through that ministry that brought me to the thing that I really want to talk about, which is Quarantine Together on Orcas Island, which really grew out of my writing background, which came from Prescott College. And I was thinking about these folks who were so isolated, and the fact that I didn't really want to drive all over the island to go and visit people because I have a couple of autoimmune diseases and I had pneumonia in February. So I'm a prime candidate to not put myself out there. And what happens on Orcas, and I think, again, this is an island community. Prescott is an island community. It's islanded, even though it's not surrounded by a moat. And I think that I learned a lot from living a long time in that community. And when I came to Orcas, I found some very similar dynamics. And I found out of my class of 53 graduates, I found about 8 other fellow alumni who had come here and settled. So there's really some synergy there. So what we do is we share stories. We're a small town. You can't get through the grocery store or the post office expediently because you see a number of people that you know, and you don't just say hello as a nicety, but you're genuinely glad to see people, and you share stories. That's what we do. In the grocery store, at the post office, and sometimes in the middle of the street when people are trying to get by, you'll see just somebody leaning into a car window and they're talking, they're sharing a story, they're checking in. So what I did together on Orcas Island, it's using Facebook platform. I'm broadcasting live every Sunday at 3 p.m. And I just reached out 2 Saturdays ago and asked for my island neighbors to write letters to me. And I'm getting a great number of letters. And so I'm reading those during that time, 3 o'clock every Sunday. And people are tuning in by the hundreds, and it's soothing, it's satisfying, it's a way for us to connect during this time of social isolation. And it's a way for us to feel a sense of normalcy for how our culture is as islanders. And I think that normalcy is just as important as, any of the benefits you might get, whatever comedic value it has, or however good it is to hear that that so-and-so is doing okay. Just having some routine and some normalcy, I found that I needed it for myself, and I found that other people are valuing it as well. So that's been really lovely. And there's a lot of kindness and great relief and benefits that people are bringing to each other on the island. That's one of the benefits of being in a small community. And then, we're faced with also the limitations of 11 hospital beds for a county that has about 14,000 people, and transportation and supply issues, and a lot of people without jobs. In my position at the co-op, it's early days. We've instituted a number of measures, waiving late fees, no disconnects for unpaid bills. If businesses want to disconnect, we won't charge them when they reconnect. we're trying to identify disaster funds that we can pass on. We have some options to bring more funding into our payment assistance programs. But, you know, it's early days. Right now, everybody's concerned about it, but they haven't gotten a bill yet without a paycheck to cover it. And so it's going to be very challenging to see what we can do. And as a cooperative, we don't have a big pool of funds in reserve that we can draw on. We're at a cost of service, and we really care. We're member owned and operated. So it's going to be a big challenge to see how we manage this and how long it lasts, and really curious about how all of our communities will change after this experience. And I just had this idea after closing off our UU services to do quarantine together. And now it's such a rich experience. I think I'll probably put it together in a book when this is over. And it's given me a lot of energy to have this purpose and to look forward to these, marks on the calendar to keep connected. And so I'm really grateful for all of that. And I'm grateful to be on Orcas, where social distance isn't a big issue. We're really privileged that way. I think that, I wanted to say one other thing though, to Jen, who was talking about their energy plan in Duluth that they've hold. I mean, my big push right now is that in the Pacific Northwest, we have carbon legislation and climate change requirements that we are transitioning away from fossil fuels, not just like everybody is, we all need to, but we have superimposed deadlines. And so it's really going to be an interesting challenge. And COVID is kind of setting the tone for a sky is falling scenario that we're going to have to carry through, kind of like when I was at Prescott College, just the environmental work that we were doing to get people to, get off their dime and really give up their fossil fuels and invest in renewables, which is going to, again, cost a lot of money and pressure the already challenged co-op members who may have a difficult time paying their bills. So that's it.
Wonderful. Well, thank you so much. It's good to hear about the work that you're doing up there, and the ability to maintain sort of a social connection despite the isolation. I think one of our future conversations will focus on COVID and climate change legislation and practices too. So hopefully we'll have a chance to return to that conversation. So our next presenter is Davida Toric, I hope I pronounced that right, who's a clinical counselor in Marin County in the Bay Area. And I definitely wanted to have somebody who is working in mental health, just given the various pressures that we feel during this time. And Davida, thank you so much for joining us.
Thank you, Laird. Yeah, I feel very honored to be here because it seems like so many of you are out there kind of almost on the front lines working with people who don't have much resource. And I tend to work with people who have a lot of resource and a lot of privilege here in Marin County. Even though their anxiety and their fear is very similar, it's an interesting quality where to deal with people's anxiety, their depression, their way of relating to each other in the bigger scheme of things, when they are not worried about losing their jobs. They have big, beautiful homes and lots of food, and so it's I feel quite humbled sitting here talking and listening to all of your work out there. And yet I guess I'm helping individual families one at a time learn how to enjoy each other when they don't have to do so much, that they can actually just go outside together and enjoy a walk when they normally don't do that with each other. So that's been a real joy to kind of work with families to get them to switch how they normally are.
I also do another work where I do lead with a group of teachers movement meditation. So we have a really big community of people who come and dance with us every week. About 100, 150 people come several times a day to dance together. And we did about 4 weeks ago decide to stop those. And quite a number of people were really like, this is their one opportunity to be in community. And we were like, we can't do it right now. And so there was a lot of pushback for a little while until the stay in place in the Bay Area came in. And now we've been really creative working with Zoom and offering these dances online. And we now have people from all over. We've had people from Israel, from Italy joining us, from Germany, from Turkey, and all of a sudden we have like 500 or more people in these Zoom communities dancing together and somehow celebrating life. So I guess my part of it is finding the joy of connection, even though we're all in isolation, that somehow making the use of this little computer in front of us is connecting us all over the world. So that's how I'm doing my part, in it. And it's been pretty effortless in terms of my work as a mental health counselor because I'm in private practice. Most people were pretty easy with switching to online and working on the phone. And again, I am working with people who've got the privilege of kind of doing that effortlessly. So I just really applaud all of you out there doing the work you're doing. So thank you.
Well, thank you, Davida. That's great to hear. I've heard people sort of reframe that whole idea of social distancing instead as physical distancing and social solidarity at the same time. And I think the technology allows us to begin to think about that in ways that are more imaginative.
Exactly, being creative through this whole process. Yeah.
Well, thank you. I'll probably try to tune into one of your dances at one point.
Great. I would love to have you there.
Good. Well, next up we have Bailey Ray, who's a Green Mountain grad who works as a campus advocate for WISE, an organization in the Upper Connecticut River Valley between Vermont and New Hampshire. And Bailey works primarily in Hanover, New Hampshire. It's an organization that works to end gender-based violence through advocacy, education, and social change. And I thought it was really important to have this perspective represented at a time when we're encouraging people to stay at home, keeping in mind that even if they do have homes, home is not necessarily a safe place for everybody. So Bailey, welcome.
Hi, thanks. I am so honored to be on this call with all of this incredible knowledge and everyone's sort of spirit coming together, and I really appreciate it. And it's also just, it sort of gets me right in the feels to be able to sit with other Green Mountain alums. I am not a Prescott person, I am a Green Mountain person. But it's nice to still be in community with folks, so I really appreciate that. So I do work at WISE. I am an advocate. Advocates tend to be sort of the unseen component of a number of different systems that are involved in gender-based violence. So gender-based violence can include domestic violence, sexual violence, stalking, harassment. We call it gender-based violence because we want to be very clear that the systems and the oppression and the harm at work is a result of power that is divided based on gender roles. And so we serve people of all gender expressions and identities. The folks that we see the most of are women and femme-identified individuals. I do work in the Upper Valley area, and WISE is part of 2 state coalitions. So we belong to the Vermont Network to End Domestic Violence and also the New Hampshire Coalition to End Domestic and Sexual Violence. So we are members of both of those coalitions, and we are also beholden to two coalitions. So that is interesting sometimes. We respond to and serve 5 hospitals, most notably Dartmouth Hitchcock Medical Center, which some of you may recognize from the news. DH was one of the first, sort of the epicenter of the New England spread of COVID here. 6 colleges, again, most notably Dartmouth, and my role in particular is in responding to the needs of campus survivors. So I work very closely with anyone in the Dartmouth community that's been affected by gender-based violence. I work specifically with the Title IX office, the counseling and wellness offices, the deans, Hanover, New Hampshire Police, which is where Dartmouth is located. We work with 2 different courts, so Vermont and New Hampshire, and have to be somewhat familiar with 2 different sets of state statute around domestic violence, sexual violence, custody, divorce, that type of thing. And we respond and work with 16 different police departments, not including the 2 state police forces. So we have a pretty wide reach. We have 7 different co-locations, including the Dartmouth office, which I man. And advocacy, we take the social change view of advocacy. So we believe that advocacy is an action that works with people who are not in power to change the things that people who are in power do. So being able to shift the decisions and the actions of people who hold power to be able to amplify the voices that you're typically not hearing. We work with about 1,300 survivors a year. It averages out to about 176 people a month. So the demand is really high. And the thing that we work around most, specifically in the last year, is housing insecurity, precarious housing issues, and homelessness in general. So housing is a big component of domestic violence. One of the reasons that a number of survivors don't end up leaving harmful situations, in addition to having kids, shared kids, is having no place to live. And with the power and control that comes along with domestic violence situations, abusers very easily take control of finances, they take control of the housing situation, they take control of all of those resources. So what happens when home, where you are being asked to stay, is not the safe place to be? The way that WISE has responded, I have been in self-isolation since March 12th, when I started showing a cluster of symptoms. And on the 12th, WISE had said, we're going to forge ahead. We're not going to make any differences. We're going to continue to be in schools and hospitals, everywhere that we need to be, because we are essential personnel to the community. And by the following Monday, we transitioned completely to remote work. So it is a testament to our nimbleness, I think, to be able to say, we will not stop serving our community. We're just going to do it in a different pathway. I apologize too. I have a bulldog right next to me that snores really loud. So if you're hearing that, I'm sorry. That's the bulldog. Sorry about that. Yeah, so we made this big switch to remote work. It's not entirely unusual for us to be doing things over the phone, because we are available 24/7, 365 via our crisis line. And so we're already pretty used to manning the organization outside of the office. But it's been really interesting to not go to work for the past 2 weeks. And we've just been finding different ways to stay in communication. This is my 8th Zoom call of the day. So I've been in crisis advocacy team meetings, prevention and education meetings. We do a staff lunch, and I was in a 4-hour Title IX interview earlier, and then a couple of other things. So we've been really raising Zoom stock just in the past 2 weeks. Yeah, so we're used to doing hospital accompaniments, specifically around forensic exams, what colloquially we would think of as rape kits, and we effectively have been shut out of the hospital. We agree with that decision for public health reasons, and so we're having to be creative about the ways in which we can make contact with survivors when they are coming in for either SANE exams, DV injuries, any sort of, like Liz was saying, comorbidity stuff. So oftentimes a lot of mental health issues also goes along with violence issues. Most of what we've been doing is over the phone. So we are lucky to have incredible relationships with the hospitals that we work with, specifically DHMC, Dartmouth Hitchcock Medical Center. A lot of acronyms in this work, to know that we feel really secure that they're going to continue to call us, even if we're not going to show up in person. We've had to learn what steps the 2 different state courts are taking in terms of filing protective order petitions. What do divorce and custody hearings look like right now? Are they even going forward? How do you get something notarized if you're not able to do it in person? So being able to just keep up with all of these changes. And these changes are happening day to day. So every single day we're being briefed on new changes, new steps, as both states have slowly essentially started shutting down. So both New Hampshire and Vermont have shelter in place orders now. As of last night, I believe New Hampshire issued theirs. So the biggest thing right now is getting people into safe housing. We have 24 access to shelter, either through our safe house or through state funding, where we are able to put folks up in motels. Our shelters, I was thinking about what Lee was saying, our homeless shelters actually have essentially shut down. We have no warming shelters anymore. And the warming shelters are starting to move into the motels that have otherwise been used for catastrophic homelessness due to domestic violence. So right now, the state 211 number, which is what someone would call if they're experiencing homelessness, is experiencing an average of 300 calls a night. The wait time is well over an hour for each call. And so when you are outside and there is an adverse weather condition issued in the state, and you've got 2 kids with you and you can't go home, that's a rough wait time. So we have contacts within the organization where we can send people directly as opposed to waiting on the phone for that long. But it's been really challenging. Our work is really challenging on a good day, and this has made it even more interesting. So we're just staying tuned. Thanks.
Well, thank you, Bailey. It's such important work. And I know that one of the resources that we already have on the shared document has to do with helping people out of domestic violence situations. If you know of any other just general broad resources that would help people in a variety of states know how to find the kind of services that you're offering, it'd be great to have something like that up there as well. So, well, you know, the virus affects us in so many different ways, and the fact that this is an election year means that it affects us in ways that it wouldn't most of the time. And so we're very lucky to have with us Candy Emmons, who was a student of mine at Green Mountain some time ago. She's the operations director for the Democratic Party of Oregon, and asked Candy to talk a little bit about creating a safe elections infrastructure in time of coronavirus. So Candy, thank you so much for joining us.
Yeah, thanks. Glad to be here. Thank you so much for all the folks on this call who have been talking about some of the frontline work that they're doing that's really urgent and really critical. I think you all need to make sure that we need to make sure we're taking care of our healthcare workers and our other frontline service workers. So thank you folks so much. So in my role with the Democratic Party, I get to do kind of a combo of things, and I won't go too much into detail with that because I know we don't have a lot of time today, but one of the key things that I've been doing for the last couple of years is developing relationships with other state parties and other actors that we can provide them with resources. So Oregon, we are a very progressive state. We have a really strong state party, and we have been able to work really closely with some of those other states over the last couple of years to help them as well, and also to learn from each other. And then this happened, and it changed everything that everyone's been planning on really, really rapidly. So, you know, so much of what we had talked about was about educating people and outreaching to voters and making sure people had voter registration cards, and that we were going to go knock on their doors and go to those farmers markets and all those things that you always see folks do in election years. And so how we can support them. And you know, over the last 2 weeks, states are changing everything. So we're seeing states moving their primaries. We're seeing states change how they're handling their elections for delegates to the national convention, which we aren't getting a lot of guidance on from the DNC on how that process might be affected as well. What we are talking about is vote by mail and absentee balloting and different ways that we can help voters access the ballot. And so in Oregon, our Senator Ron Wyden, he has been a proponent of this for his entire career. Vote by mail is not a new thing for Oregon. We've been using it in some form since 1981, but we've been 100% vote by mail since 1998. So I voted for the first time in 2008 from my dorm room in the basement of Lyman Hall for Barack Obama, and I put my ballot in the mail and mailed it home to Oregon. So those are things that we all, that we in Oregon feel really comfortable with. And we know that vote by mail increases voter turnout in a normal election time. And so right now we are working with other states to talk about the ways that they can use vote by mail infrastructure and what needs to change. And there are a lot of things, moving pieces constantly. So I think in everyone's job right now, that is true. Day to day, we're getting new information, but what we are trying to do right now is support this big bill that's coming through the Senate that they're trying to pass to give funding to states that do not have vote by mail infrastructure. Some states like Oregon, it's 100% vote by mail. So I think Oregon, Washington, Hawaii, Colorado, 100% vote by mail. Every voter gets a ballot in the mail. There are some states like Arizona where there is no excuse absentee. So any voter can request a ballot, but you have to request that ballot to get it mailed to you. So how we communicate with voters in Arizona that they need to do that. And then there are some states where you have to have an excuse. So you have to be ill, or you have to be a student that's living away from home. And those are the states that we really are working with collaboratively to help them move that needle so that more voters have access to the ballot. Because as we all know, this election year, I know folks on this call probably range the political spectrum a little, but this is an incredibly important election year. And the last thing we want is a situation where voters don't have access to the ballot and or our election gets postponed or harmed in some way in November. So what I will say to folks on this call is, I know there are people sitting at home feeling that there's not a lot that they can do. You can call your senators, you can ask them to support those bills. You can get involved with local candidates running for office in your community. If you are a student in Arizona right now, tuned in, make sure that you're registered to vote, whether you choose to vote at home where your family is, if it's out of state or in state. You've got a very important Senate race on the ballot, and you can request that vote by mail ballot, so you don't have to worry if this isn't cleared up by November that you'll be able to go and vote safely. So it's a changing world always, but we're really eager and excited to use our expertise in Oregon, where we've successfully implemented vote by mail, to support other states as they talk about outreach and grassroots activism in a very different way than we've ever done it before. So
that's wonderful. Thank you so much, Candy. Yeah, hopefully, I guess that bill going through the Senate is coming up within the next week.
Don't know yet. There was a small amount of funding in the bill that was signed today for vote by mail, but it's not enough. So now they're retooling the bill and seeing how they can adjust it to try to get something through. So. Okay.
Well, I think it's clear that we'll be asked to rethink the way that we do a lot of the processes that we've taken for granted through our lifetimes, and this is one of them for sure. So I'm so glad that you could be with us. Is Sierra still out there? I haven't seen Sierra on the screen here. Oh, there you are, Sierra. Awesome, good. So I wanted to sort of bring this to a close with Sierra because unlike the rest of you who are alumni, Sierra is a current student in our Masters of Science in Resilient and Sustainable Communities program. In fact, I just today saw paperwork for her capstone committee, so that's great. Sierra is the Sustainability Program Coordinator at the University of Pittsburgh for the Student Affairs Division. And Sierra, I think rather than describing what you do, I'll just let you jump in.
Thanks, Laird. And thanks everybody that's spoken before me. It's an honor and a privilege to get to share the proverbial stage with so many alumni who are doing great things in their communities. And thank you to everyone who's attending, who chose to spend your Friday night with us. I'm going to keep my comments pretty brief because I know folks have other plans and things they need to get to, but I'll make sure if you have any questions, you have my contact information, and I'll be sticking around as well. So to give a little bit of background on basic needs at the University of Pittsburgh, we're a large urban research institution, so we have about 30,000 students when we count both undergrad and graduate. And when it comes to food security and housing security and other basic needs, we've been playing catch up kind of for a long time now. So we're situated in Pittsburgh's Oakland neighborhood, which is a food desert. There is one grocery store in the neighborhood. It is operated by the university, and there have often been comments and issues amongst both students and residents around affordability, as well as with housing. Our residence halls have been consistently overwhelmed. We've actually rented out a couple floors in a hotel for the last 2 years to house our students. So prior to the COVID-19 situation, we were in a place where we are consistently trying to come up with creative ways to continue supporting the students that we have, while also recruiting and encouraging students who come from diverse backgrounds to come to Pitt. So the situation developed pretty abruptly for us. During the first week of March, we tested remote working for staff for 1 day. So people who were deemed essential still came to work. I was not one of those people. But at that point, it was just considered a test. Our spring break was March 8th through the 13th. And that Thursday of break, all of our students got an email telling them two things, that all of their classes were being moved online, and that if they lived in a residence hall, they basically had 1 week to evacuate. So I had students coming to me who were on spring break who said, I can't tell you why, but I can't go home. And so that was an initial priority for me, as someone who works in the area of basic needs, making sure that I worked with our housing and dining departments to get those folks set up with places that they could stay on campus. And overall, the university did a really good job of responding to students who had concerns about going home or not having a home to go to. So all those folks were moved into apartment style housing. So there was one person in each apartment at this point, and they have their own kitchen and living facilities. So that was really great. In terms of food, I am at this point the point of contact for anyone who has any food assistance needs, be they student, staff, or faculty. So I think something that Erin said that rings true for us is that decisions that were difficult 3 weeks ago are now no-brainers. So when we got that email on Thursday, our on-campus food pantry had been operating for 5 years, and it operates largely with student support. So the joke is that I don't really do anything for the pantry. But as of that Thursday, we no longer had student volunteers. So our original plan was to keep the pantry open 1 day a week and try to continue utilizing that shop-through model, which has been shown outside of these circumstances as national best practice. So we did that for 1 day, and normally during the course of a day, we would see 2 to 5, maybe 7 clients and families come in per hour. In our first hour, we served 23 people. So at the end of that day, it was kind of realized by the staff who were in the pantry and by our senior management that that was no longer an option. So we did transition to doing prepackaged bags for our shoppers. We started offering them out of the pantry, which is in an off-campus building. It's in a church across the street from one of our main residence halls. About 3 days into that, the church closed. So we transitioned to prepacking those bags and putting them in the lobby of one of our residence halls, which we did for basically until this Monday. And then on Monday, there was a confirmed case on our campus of COVID-19. The lobby was closed all residence halls were closed and all campus buildings were closed. So we actually had a little bit of a moment of panic where we went to access the bags that we had packed for students, and all of our swipe access had been revoked. And we had to have the police let us in. So at this point, because of our lack of facilities and our capacity, we've transitioned to a two-part strategy. So the first part is to directly support our students. We're doing that by providing them meal swipes remotely. So there's a form that a student can fill out if they're in need of emergency food assistance. And we basically put 10 meal passes on their student ID card, and they're using them at one of our on-campus dining locations, and it's all grab and go. They've taken a lot of precautions in terms of social distancing and sanitation. And then our other piece of the strategy is thinking about community-based resources. We were never the only pantry in our region, and in the past we've had I would say touch and go partnerships with the other food pantries, but we started thinking about how we can not only encourage our students to utilize campus or community resources, but how we as a university can support our community providers. So last week I did some outreach to the largest food pantry in the neighborhood where we serve to get an idea of where they are and what they need. I spent most of today volunteering with them. We're working on providing some financial incentives to them as well. And we also took basically the remainder of our inventory and sent it over there. So at this point, we're working on the swipes, which at this point we have enough to last 2 weeks. Those swipes were all donated by students in the previous semester as part of a meal scholarship program. Which we're extremely grateful to have at this point, but it's not the most sustainable option for us. And then making sure that we're in contact with our food bank and with our community providers, making sure that whatever we can do to support them, we are. And I just wanted to take a second to reflect on how this situation has taught us that what were our vulnerabilities, which are being brought to light, are also opportunities for resilience. So for a long time, we were receiving feedback that our campus grocery store was too expensive for students and community members, and now we have an opportunity to really look at that critically and think about what we can do as a campus community to make it more accessible for students, as it becomes more likely that that is the option that people in our region are turning to for their groceries. Likewise, we're reconsidering the fact that our pantry is in a non-university building, which has created some challenges for us historically, just not being able to access space whenever we might need to. So I think that as troubling and as frustrating as this situation is, it's given us a new lens and perspective to start building resilience as a university community. And I am hopeful that going forward, these lessons won't be forgotten, and it's going to give us a chance over the next several months to really build our capacity to serve our students in the way that they need to be served.
All right. Well, thank you so much, Sierra. It's so inspiring to see the work that you're doing and the work that you're going to do. So I really appreciate that. I have been given sort of a caution that it's possible that Zoom will cut us off at some point. We've gone a little bit over the time that we had planned on, but I'm really interested in continuing the conversation as long as we can. But if for some reason we do get cut off, thanks so much for joining us. I did ask Ron Steffens, who does teach our emergency management and communications course here, if he could say just a few words about best practices in emergency communications, as we're all dealing with that right now. And that might be a sort of segue, Ron, into our whatever questions we have that students or that the panelists may want to address. So I'll hand it over to you for a minute.
Thanks, appreciate it. And let me know if you can hear me. The heater just came on here in Southern Arizona, so we're getting a little cold spell. You know, I think the lessons learned in part are the value of education. I mean, the panelists and the staff and faculty and the attendees incredible commitment and expertise and passion to serve in this challenging time. I've been thinking a little bit about my time living on the Oregon coast, where we've spent a lot of efforts to prepare for a very large earthquake, and I've kind of moved away and hopefully we'll never experience it. But the coast tries to prepare for 4 to 6 weeks of isolation, and now much of the world is trying to figure out how do we do this at a global scale. And then never, I mean, people had planned for this and thought about it, but never had hoped it would never come. So the only thing I did put a link in a little earlier, and I'll share it on that doc too, is the CDC has 6 points for communication in a pandemic or a medical emergency like this. And number 4 is express empathy. And I would just say that hearing the conversations and what's going on in the communities that folks are leading is empathy is not always our strongest aspect of governance in particular. And I think some of us have, all of us are involved in governance in one form or another. And I was hearing it expressed quite well throughout all of this discussion. So I just add that and take a look at some of the links and keep in touch with each other. I mean, I've one of my challenges as a fire manager this summer is how to bring 200 to 300 firefighters together to manage a fire and have us maintain our social distance. So I'll be thinking of you all and how to, I like the sleeping head to toe because that gives us something right there that I can borrow from Lee. So thanks for that hint. So that's all I've got, just to reflect and glad to help. Any other questions or thoughts?
Let me see if Carla is able to join us. Carla or Liam, if you've been monitoring the questions on the chat and there are any questions that you feel like you may want to put to the panelists, that would be great.
Hello, yes, I'm still checking out the chat and seeing the conversation that's here, but mostly comments, some wonderful resources shared by our panelists and some others, but I have to say that right now we don't have an open question.
Okay.
Yeah.
Well, let me put it to the panelists then. Is there anything that you would like to ask of each other or respond to from each other?
I'd like to ask a question, Laird.
Sure.
Yeah. I'm wondering if there's anybody in I'm not sure who's listening to this, by the way. I'm not sure who the audience is, but if there's anybody in the audience that would be interested in being trained in another community on how to start up a Friends for Life, a courier branch to get essential items to elderly and homeless and other people. And if that's the case, what we'd like to do is set up something similar to this and have some informational conversations and then maybe some train the trainer type sessions where we can train people in other parts of the country about how to help other people in a similar way. And so if there was anybody interested in that type of thing, I'd love to have them contact me.
Good. That sounds great. And we do have your email address, but because we'll be sharing the transcript with everybody who was a part of this call, if you prefer, we can just redirect people who are interested to you.
Yeah, that'd be great. Thank you.
Yeah, you bet. And I would imagine maybe we would want to do an article on you at some point about the work that you're doing that we could send out through various social media channels and perhaps encourage people in their own communities to replicate what you're doing there. It's such a great idea.
Hey, I really appreciate that. And I do appreciate the press release that Prescott sent out a couple days ago. That happened really quickly, and I really appreciate it.
Absolutely. Anyone else have anything that they would like to ask or say to one another?
And I think this is Ray. I think the question that's on my mind, and I think for many of us, is, how sustainable is the work that we're currently doing? So, we right now scientifically have the capacity. We're expanding both testing. There's potential vaccine development. I currently teach at Harvard College, and sort of we're completely remote, and we're even switching to a new model of grades with the hope that the semester will begin again in the fall. I'm curious for all of you who are doing work on the front lines around sort of healthcare or working with sort of different sort of populations. What's the breaking point, right? We're 2 weeks in realistically. I think one of the panelists is 6 days in. What does the projection look like at 30 days, 60 days, 90 days? Because this is not ending anytime soon. So I'm just curious, what are the risks, and how are you thinking about contingencies in this case?
I think
we're planning and budgeting out for 90 days.
Was that Liz?
Oh, no, from the medical community standpoint, we're very, very close to, unfortunately, what we're seeing is that we are close to a sort of breaking point, because if we don't, this is why I think on a level, in some ways, the medical community is stressing the social distancing so much so, because and we keep stressing the flattening the curve. If we slow down the spreading, the current resources that we have will be able to sustain it, but we have to kind of stretch that out over 18 months or so. If we can kind of spread it out as far as we can, because right now the shortages are going to be the N95 masks, the PPE, the nurses. There's some hospitals, of course I won't name any names, there's hospital employees that are saying, I'm being asked to reuse my protective equipment. And I'm like, well, that's not as protective as it should be. And then there's the question of how long these organisms can be viable on certain surfaces and what that looks like, and as far as transmission. So we're kind of in that place. And so we're really pushing for that social distance piece, not necessarily because the people who are being asked to distance themselves are the ones that may get sick, but if you don't, you might be okay, but your grandmother or, your neighbor who happens to be in their 70s, 80s, though their immune system might not be okay. And because the incubation period, or like the period in the very beginning, you can go up to about 2 weeks without actually exhibiting very many symptoms, which becomes a little bit more worrisome about transmission and things like that. So yeah, that's why we're kind of in that, I guess, very, not necessarily reactive, but very, we're pushing forward with a lot of things, because it was very poignant that what one of my mentors have told me. They said, if we overreacted, then the worst that can happen is nothing. Then we'll look like the people who were completely out of control, and they're like, oh, they were always, out there with their thinking and overreactive. But if we were right, all of the people in this room that have that mentality, it seems that we're all on the same page here. If we're not in that vigilant stage and we're right, then we're in trouble.
Lee?
I said we're counting on we're budgeted out for 90 days right now. We know that Seattle, which is way ahead of us, is talking 18 months. We're not really ready for that. We're a lot smaller. And if I do the percentage figures based on, 40% of this is even for the homeless people, 40% getting sick, 40% of them having a severe problem, 15% really critical. We're somewhere between 80 and 120 at a point in time, and so I think we're at the right scale, but just barely. And anything could tip that either way.
Liz mentioned that it seems like we're all on the same page here. I received one comment when I was trying to get interest in being on this panel from somebody who works in a grocery store, who was talking about the work that she does. And obviously people like AOC have pointed out that this is forcing us to rethink the distinction we make between essential services and non-essential services. And the people certainly working at the grocery stores, we're understanding how essential they are right now. But a woman who worked at a grocery store who pointed out the fact that some of the people that she worked with, including her boss, were not taking the precautions seriously and were making fun of the 6 keeping at your distance and that sort of thing. And it really helps me recognize that in a sense, we're continuing to engage with each other in our own bubble in the way that we've also done in terms of political conversations and that sort of things, and figuring out how we puncture those bubbles in ways that allows the kind of conversation that we're having to begin to trickle into other people's consciousness. That's a really important conversation to have, and I'd welcome any suggestions people have. How do you convince people who are not taking it seriously? It's probably too much to hope for an answer that.
One of the things that I've been doing is talking with people about how our instinct when things are outside of our control is to take control in one way or another, and that often looks like resistance or being defensive, or we act out when we're not able to control out. And so I had a conversation with a friend the other day who was like, I'm going to go see my mom. I'm just going to do it. And I was like, she's 72 and she's got asthma, and was talking with her about, like, I know that you're really scared about this being outside of your control right now. I'm also super scared. Like, I want to be under a blanket all day. Is there a way that we can channel that feeling of needing to take back some sort of control in a way that isn't going to inadvertently do harm? And so I think, like, my impulse is always to sort of just like really hit people over the head with stuff, and I'm finding having to dial that back a little bit is a little more effective in terms of just, it's that empathy piece. It's that saying, like, I know that you're really scared and I'm really scared too, and maybe we can be scared together, 6 feet apart, but like together, and we can kind of talk each other away from doing some of the things that might hurt ourselves or other people.
Thanks, Bailey. Anybody else want to tackle that one?
Yeah, I've quoted CNN did a little piece where they visualize what 6 feet looks like to different people. And for one, I think it was 2 Labradors, two really large cats, but I like the moose antlers because partly if you're going to be on one side of a moose that close, you're going to move away anyway. So, but I was thinking of Vermont and other places where our friends moose are, Minnesota. So yeah, I think a little bit of humor can help, and that may be a way to engage people who are coming too close. I also wondered that, particularly with firefighters, that your sense of smell might be limited when you start to become infectious. So I thought, well, maybe we just stop showering, and then if someone comes too close, they're infected, and so you just like push them away. But that may just only be good on the fire. Well, maybe sometimes when people have limited cleanliness opportunities, it could be universal. So, but I think reaching out to people in ways we can safely, whether that's online or phone calls, and a little bit of just asking where you at, and I think Bailey, you had a good approach of when we can't control, we act, and maybe helping people give their story and then try to shape them.
Yeah, I mean, I think one of the things that holds true both with regard to other questions of, whether outbreaks or other sort of medical issues, but is also showing up right now in the public opinion research, is the extent to which individuals prioritize information from family and friends over the White House, over Congress, over policymakers in the media, and even over the CDC at this point. Though the CDC still has some amount of credibility. And what that means, I think, is that it's in some ways an onus on all of us to make sure that we convey the severity, but also try to empathize with people's sort of concerns or their their various sort of beliefs, you know, about the severity of this pandemic. As I think many of you probably experience, I have parents and I have in-laws who who are from the medical profession and don't seem to understand or grasp the severity of the effect potentially for them and their friends. And, you know, I think sort of trying to shove that down their throat, or try to, instead of giving them sort of access to like to really life examples of what's happening. And I think the more and more in communities, and I think the individual who's a mayor on this might attest to that people are actually seeing people who they know who have been affected, then actually heightens the response and the sort of the understanding of potential real catastrophic impact this can have on the United States and in the globe.
Yeah, I think that will become less of a challenge for us as more and more of us know people who have been affected. You know, my own sort of default is always to, if I have a hard choice, err on the side of compassion. And I think that talking with people who may be somewhat skeptical, maybe to even express some empathy with the fact that, yeah, it's hard to know what to trust these days, but you know, just the very possibility that somebody that we love or that you love could be infected leads us to be as careful as we may be. I think there are ways to have that conversation, but those are ways that require us to be pretty thoughtful, I think, and not just dismissive or why can't you see? Isn't it clear to you? So, what else? We've got at least a few more minutes here that we can be talking about either this question or other questions that may have been raised.
This is Liz. I wanted to kind of say thank you to Liam for pointing out that a piece about medical professionals are usually the ones that are most stubborn, and that's actually true. And they actually have the largest exposure because they work with actual confirmed cases. And what they say is, well, I'm okay because I have, you know, I wash my hands and I know what to do and my immune system's okay. And something that kind of struck me is, unlike the rest of all of the esteemed members of this panel, I'm actually not, I'm a faculty member, but I'm not an alum. I'm actually also the wife of another employee at Prescott College. And so I go through a somewhat of it looks ridiculous, but it's out of more care for, just like Bailey was saying, you know, I want to be, if I can't control something, I kind of want to act out instead of in. And so in the spirit of grounding and being kind of more thoughtful, as Laird mentioned, as far as being, you know, compassionate and thoughtful of the other, I do like the crazy strip down on the way in from work and going straight to the shower and having hand sanitizer by the door. It looks kind of ridiculous on the outside, but I think that this is one of the things that I can share with this particular group, because I think everybody here kind of is like, well, we get it kind of thing. Because I mean, even my own colleagues are the ones that are like, well, I don't know why you do all that extra stuff. It's not like, you know, not like any other virus. And I'm like, actually, kind of. It's a lot different. Yes, it's similar in the fact that it's a virus and it's in the same family as the cold virus. True. But it's a lot more efficient and it's got a lot more bells and whistles, and it's kicking butt and taking names, and you can see it. And it's really efficient if you look at it. So it's been pretty amazing. And so for the rest, the one thing I wanted to also say in gratitude is that if there's anything that I can do to help to be of assistance to you all as far as immune boosting and just preventing getting sick, because if we're the ones on the front lines and and if we get sick, then it becomes even harder to, you know, do the work and have the work get done, and for the people that we serve to get the help they need. So if there's anything that you need, if there's anything I can do, please let me know. And thank you.
Liz, I'm sorry, Lee, it looks like you're trying to speak, but we're not hearing you. You may be muted.
How's that?
Oh, beautiful.
Okay, great. There's several different buttons here. One of the things I've really been trying to work with our staff on here and our general public of CHUM, there are many thousands of people who support us, is as part of our briefing, something that's inspirational and reflective of every day. And one of the best pieces that we've shared a lot, and it's gone all over, is by David Haas, who's a liturgical composer. And I can't do the whole thing because, again, for a lot of things, and I'll share it with you when I can find the link, but there are a lot of things that are closed, but kindness is not closed. Conversations are not closed. Families are not closed. Patience is not closed. Compassion is not closed. And he goes on and on. Meditation is not closed. There's lots that's not closed, and it just really recenters me and recenters people who we share that with to look at that. And I think it's really important to be able to step back in a distance and say, okay, here's my reactive part, but here is my center. And however we can stay in that and take a drink in there, that's a good thing.
Thank you. Well, I want to be mindful of the fact that we've been at this for a couple of hours now.
Yeah, it's a long time.
And I think this might be a good chance to wrap it up. As I said, it's my intention to hold regular community resilience conversations. So if you have any suggestions for topics of conversation that you would like to see over the coming weeks, I've got a bunch in mind myself, but I'd love to hear from you all. And maybe even suggestions of people that you would like to hear from as well. So Carla, your face just popped back up on the screen. Was there something that you had to share?
No, not at this time. I'm just going to announce again that we'll share the chat again in the coming days. And what a wonderful panel. I just wanted to say thank you.
It was great, wasn't it? And I'll remind you again that if you know anybody who may be interested in pursuing an online Masters of Science in Resilient and Sustainable Communities, next Thursday at 4 o'clock Pacific time, we'll have an online information seminar. So thank you so much to everybody for being a part of this. What a great group, and I am inspired and sobered, and I think that's just sort of the default place that I find myself in now. But the inspiration is something that we can never have too much of. So thank you so much for all the good work that you're doing and for the sense of community that you're sharing here online. So
good job.
Well, thank you. Take care, and we'll hopefully see you all around.
Yep.
Take care all.
Sawdust Trail.
Thanks.
Bye-bye.
Take care. Be